One small pill or one wrong mistake can decide your sexual health for life. Millions of men silently suffer from erectile dysfunction. Some medicines fix it. Others, if misused, can permanently damage your body. Today, I'll show you the safest, most effective erectile dysfunction medicines and the dangerous mistakes you must avoid. Erectile dysfunction, what every man must know. Erectile dysfunction, ED, means difficulty getting or maintaining an erection. If untreated, it can damage confidence, relationships, and mental health. ED happens due to psychological stress, physical illness, poor lifestyle habits. The good news? Modern medicines can safely treat ED if used correctly. Let's break them down. Number 5. PDE5 inhibitors, first line and most used. These are the most effective and commonly prescribed ED medicines worldwide. They work by increasing blood flow to erectile tissue, helping maintain a firm erection. They do not work without sexual stimulation. Sildenafil Viagra, dose 25 milligrams, 100 milligrams. Onset 30 to 60 minutes. Duration 4 to 6 hours. Max once per day. ED is treatable. Pills work best when used correctly. Misuse can cause permanent damage. Always follow medical guidance. Never self-medicate. Your health matters. Fast acting. Never combine with nitrates. Overdose can cause severe side effects. Tadalafil, Cialis. Dose 10 to 20 milligrams. Onset 30 to 45 minutes. Duration up to 36 hours. Long-lasting. Also helps enlarged prostate. Can cause prolonged erection in some. Vardenafil, Levitra, Staxin. Dose 5 to 20 milligrams. Onset 30 to 60 minutes. Fatty meals reduce absorption. Delayed action if taken after heavy food. Avanafil, Stendra. Dose 50 to 200 milligrams. Onset 15 to 30 minutes. Duration 6 to 12 hours. Fastest onset. Newer generation option. Number 4. How these medicines actually work. They increase cyclic GMP, which relaxes blood vessels, improves penile blood flow. They block PDE5 enzymes, preventing erection loss. Too much dilation equals dangerously low blood pressure. Number 3. Dangerous side effects you must never ignore. Priapism. Erection lasting more than 4 hours. Extremely painful. Can permanently damage erectile tissue. Vision problems. Blurred vision. Color confusion. Sudden vision loss. Rare but serious. Hearing problems. Ringing in ears. Sudden hearing loss. Stop the medicine immediately and see a doctor if these. 2. Deadly drug interactions. Never combine PDE5 inhibitors with nitrates, used for chest pain. Can cause severe BP drop. Risk of collapse, fainting, death. Alpha blockers, BP and prostate meds. Can cause sudden dizziness. Risk of falls and fainting. Alcohol worsens dizziness. Reduces erection quality. Grapefruit juice increases drug levels dangerously. Number 1. Alternative ED treatments. When pills fail. Alprostadil injection. Injected into penis. Works in 5 to 20 minutes. Duration 30 to 60 minutes. Painful. Requires training. Risk of prolonged erection. Alprostadil urethral suppository. Pellet inserted into urethra. Less effective than injection. Can cause burning or bleeding. Testosterone therapy. Only for men with low testosterone hypogonadism. Forms. Injections, gels, patches. Pellets. Side effects. Acne. Mood changes. Prostate enlargement. Sleep apnea. ED is treatable. Pills work best when used correctly. Misuse can cause permanent damage. Always follow medical guidance. Never self-medicate. Your health matters.